Anaphylaxis is a severe, potentially life-threatening allergic reaction that can occur within seconds or minutes of exposure to an allergen. It's a condition that affects multiple systems in the body simultaneously, causing a range of symptoms that can quickly escalate to a medical emergency. At its core, anaphylaxis is an exaggerated immune response. When a person with a severe allergy encounters their specific allergen, their immune system mistakenly identifies that harmless substance as a threat and then goes into overdrive. It releases a flood of chemicals that can cause your blood pressure to suddenly drop and your airways to narrow, making it difficult to breathe. What's particularly concerning is that for many people, their first anaphylactic reaction comes as a complete surprise. They may have had no prior knowledge of their allergy, making the experience all the more frightening and dangerous. This unpredictability shows the importance of widespread education about anaphylaxis and its management. Causes of anaphylaxis. The triggers for anaphylaxis can vary from person to person, but there are some common culprits. Food allergies are among the most common triggers, with peanuts, tree nuts, shellfish, fish, eggs, milk, and soy being frequent culprits. These foods contain proteins that some people's immune systems flag as dangerous invaders, setting off the chain reaction of anaphylaxis. Insect stings, particularly from bees, wasps, hornets, and fire ants, are another common cause. The venom injected by these insects contains proteins that can trigger a severe allergic response in susceptible individuals. Even a single sting can be enough to cause anaphylaxis in someone with a severe allergy. Medications are also a significant cause of anaphylaxis. Antibiotics, particularly penicillin and related drugs, are frequent offenders. Other medications that can trigger anaphylaxis include aspirin, ibuprofen, and certain chemotherapy drugs. In some cases, the allergic reaction is to the active ingredient in the medication, while in others, it may be to inactive ingredients or contaminants. Latex is another potential trigger, which can be particularly problematic given its widespread use in medical settings. People who are frequently exposed to latex products, such as healthcare workers or individuals who have undergone multiple surgeries, may be at higher risk of developing this allergy. Exercise-induced anaphylaxis is a less common but intriguing form of the condition. In some people, vigorous physical activity can trigger anaphylaxis, especially when combined with certain foods eaten before exercise. The exact mechanism isn't fully understood, but it's thought that exercise may alter the way the body processes certain proteins, leading to an allergic response. In some cases, anaphylaxis occurs without an identifiable trigger. This is known as idiopathic anaphylaxis, and it can be particularly challenging to manage. Some researchers believe that in these cases, the body may be reacting to substances it produces internally, but more research is needed to fully understand this phenomenon. Symptoms of anaphylaxis. The symptoms of anaphylaxis can vary from person to person and even from one episode to another in the same individual. However, they typically develop rapidly, often within minutes of exposure to the allergen, and can affect multiple body systems simultaneously. Skin symptoms are often the first to appear. Many people experience hives, which are raised, itchy welts on the skin. These can appear anywhere on the body and may be accompanied by intense itching. The skin may also become flushed and warm to the touch, or in some cases, pale and cool. Swelling, known as angioedema, is another common skin symptom. This swelling often affects the face, particularly the lips, tongue, and throat, but can occur anywhere on the body. Respiratory symptoms are a hallmark of anaphylaxis and can be some of the most dangerous. Many people experience a sensation of tightness in their chest or throat, as if something is constricting their airways. Wheezing, coughing, and shortness of breath are common as the airways narrow and become inflamed. In severe cases, the throat may swell to the point where it becomes difficult or impossible to breathe, a life-threatening situation that requires immediate medical intervention. The cardiovascular system is also significantly affected during anaphylaxis. As blood vessels dilate and become leaky, blood pressure can drop significantly. This can lead to dizziness, lightheadedness, and fainting. The heart rate typically increases as the body tries to compensate for the drop in blood pressure. In severe cases, this can progress to shock, where the body's organs aren't receiving enough blood flow to function properly. Gastrointestinal symptoms are also common in anaphylaxis. Many people experience nausea, vomiting, abdominal pain, and diarrhea. These symptoms can be particularly distressing and may contribute to the feeling of overall illness that often accompanies anaphylaxis. One of the most unsettling aspects of anaphylaxis for many people is the psychological symptoms that can occur. Many individuals report a sense of impending doom or severe anxiety during an anaphylactic episode. This isn't just a reaction to the physical symptoms, it's thought to be a direct effect of the chemical changes happening in the body during anaphylaxis. Generally, the experience of anaphylaxis is often described as terrifying by those who have gone through it. The rapid onset of symptoms, the feeling of not being able to breathe properly, and the sense that something is very wrong in your body can be overwhelming. Many people report feeling a sense of panic, which is a natural response to such a severe physiological event. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of anaphylaxis. If someone comes to the emergency room with symptoms suggestive of anaphylaxis, the focus is first on treating the immediate symptoms. Once the person is stable, healthcare providers will take a detailed history, asking about potential triggers, the timing and progression of symptoms, and any previous allergic reactions. Blood tests can be very helpful in confirming a diagnosis of anaphylaxis. During an anaphylactic reaction, the body releases high levels of certain chemicals, including tryptase. Elevated tryptase levels in a blood sample taken within a few hours of the onset of symptoms can help confirm the diagnosis. However, it's important to note that normal tryptase levels don't rule out anaphylaxis, as levels can be normal in some cases, particularly in food-induced anaphylaxis. After an anaphylactic episode, individuals are often referred to an allergist for further evaluation. This may involve skin prick tests, where small amounts of potential allergens are introduced just under the skin to see if they provoke a reaction. Blood tests can also be used to measure levels of specific antibodies to potential allergens. Treatment for anaphylaxis. When it comes to treating anaphylaxis, speed is crucial. The first-line treatment for anaphylaxis is epinephrine, also known as adrenaline. Epinephrine works quickly to reverse the symptoms of anaphylaxis by constricting blood vessels, which helps increase blood pressure, relaxing the muscles in the lungs to improve breathing, and reducing swelling. Epinephrine is typically administered via an autoinjector, a device designed for easy use in emergency situations. The most well-known brand is the EpiPen, but there are several other brands available. These autoinjectors contain a pre-measured dose of epinephrine and are designed to be injected into the outer thigh muscle. It's crucial that epinephrine is administered as soon as anaphylaxis is suspected. Delays in treatment can lead to more severe reactions and poorer outcomes. Many people with known severe allergies carry an epinephrine autoinjector with them at all times. In some cases, they may need to carry multiple autoinjectors, as more than one dose may be necessary to control symptoms. After administering epinephrine, the next step is to seek emergency medical care. Even if symptoms appear to improve after using the autoinjector, it's important to get professional medical attention. Sometimes, a single dose of epinephrine isn't enough, and symptoms can return or worsen. In a hospital setting, treatment for anaphylaxis may include additional doses of epinephrine, as well as other medications. Antihistamines may be given to help relieve itching and hives, although they're not effective in treating the more severe symptoms of anaphylaxis. Intravenous fluids are often given to help support blood pressure and replace fluids lost through vomiting or diarrhea. In severe cases where breathing is significantly impaired, supplemental oxygen or even intubation, which is inserting a breathing tube, may be necessary. After the acute phase of anaphylaxis has been managed, the focus shifts to prevention of future episodes. This typically involves identifying and avoiding triggers, which can be a complex process. For food allergies, this means carefully reading food labels and being cautious when eating out. For insect sting allergies, it might involve taking measures to avoid exposure, such as wearing protective clothing when outdoors. Now, we want to hear from you. Do you or someone you know have anaphylaxis? What symptoms did you have? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.